Those of us who sit a lot at our desks, writing or working, are at risk of compressing this area right here, the front of our pelvis, the area where our torso meets our legs, which is divided by the inguinal ligament. When this area gets compressed, the connective tissue there hardens, and that creates a lot of problems. For example, it decreases fluid flow in and out of the area and in and out of the legs, creates poor circulation, and there's a problem with the removal of waste products. It also creates tissue that is dysfunctional, that no longer works as it's supposed to be working. The fascia stiffens. It can pull the lower back into excess lumbar lordosis. It can also pull the organs. It can pull the organs out of place from their proper position. The organs themselves can stiffen in this area. There we have the colon, the intestines. In the pelvic area we have the bladder, the prostate, the spermatocord coming across there. In women, the uterus, the ovaries, the fallopian tubes. All of these organs can stiffen when you sit for long periods of time and compress this area. Tissue that stiffens, becomes hardened, is tissue that is ripe for mutation. And tissue that mutates is tissue that can become cancerous. As Wilhelm Reich says, a cancer cell is a poorly breathing cell. Here you can see in this picture in the Netter anatomy book the area that I'm talking about. This is the inguinal ligament right here. All of this white tissue here is the connective tissue. It's the fascia. This is what hardens. You can see these layers, the muscles of the abdominal wall, in between layers of fascia. When these layers of fascia harden from sitting too long, they squeeze these muscles and decrease their functioning. You can also see here the femoral vein and artery. The nerve's not pictured here, I'll show you in another picture. As it pierces through these layers, when they harden, they compress these two vessels right here. In this picture here from Clemente, you can see the artery and the vein, and here's the femoral nerve. If that's compressed, it decreases neural functioning to the leg. On this side here, you can see that at the inguinal region, what we have are the lymph nodes. The lymph vessels in green here are bringing the waste products back to the lymph nodes to be processed and then taken up into the heart. If this area is compressed, you're decreasing the immune function of your entire pelvic region and of your leg. In this picture here, we can start to see some of the organs. First, in the male, we can start to see the colon and the intestines, the bladder, the prostate. When this area here, if we're going to bring the leg up and sit at a 90-degree angle here, and then if we're going to compress this area, these organs will be compressed and hardened. Over here on the female, we'll see the same organs in the abdomen and some different organs here. You'll notice the uterus folds over the bladder like this. If we bring this leg up to a 90-degree and then compress that area, we're compressing the uterus, which is one of the causes of fibroids. We're compressing the cervix, which can lead to mutations and even potentially cancer. The ovaries there, the fallopian tube is there. You want to get up and stretch this area and keep it loose, and keep the fluid flowing through it. The best way to avoid these problems that I've been talking about here is to get up out of your chair many times during the day. To stretch this area using yoga or even simply through taking a walk. The hardened tissue in here can also be stretched using these two massage balls, the courageous ball and the alpha ball. If you've never done any massage ball rolling in this area, you want to start working with the courageous ball, moving the superficial and the middle fascia. The source of this work can be found on page 249 of Jill Miller's book, The Role Model. Note, if you're pregnant or you have an inguinal hernia, don't do this. If you recently had abdominal surgery, you have to talk to your doctor before doing any of these exercises. I find it best to work on bare skin because this allows the sticky surface of the ball to pull all the layers of the fascia. For this public video, I'll show it closed. And you place the ball on the front, starting over here on the right side, can start on either side, just above the pubic bone, nestled in here into the pelvic funnel. You're going to lie face down, place the courageous ball on the front right side of your pelvis. Lie slowly over the ball, breathe deeply into your abdomen, and let the ball sink into your tissue slowly and gently. Once it's nestled in there, then you can initiate a contraction with your right leg as if you're going to bring your knee up to your chest, but you don't actually move your leg. You just contract it and then release it. And contract it and then release it. And you do that about 5 times, slowly. Then you can bend your right knee up and down. And you do that about 5 times and you'll feel the tissue pulling through here. You can also lift your right knee up off the ground and back down about 5 times. Then you bend your right knee again and wave it side to side, like so, about 5 times. Then finally, you can contract your leg, your hip, such that your knee does come all the way up and then back down. You do that about 5 times. If you can do that easily, then lift up onto your arms. This pushes the ball in a little bit further. And you do that same movement again about 5 times. Then you repeat all of this on your left side. Use the courageous ball for at least 3 sittings, once every other day, until the tissues loosen. Once you have successfully loosened this area using the courageous ball, you're now going to go in there with the alpha ball, which is going to go in a lot deeper. So first of all, we have to figure out where we're going to place it. So where is your inguinal? If you think about this line here where you bend, that line where I'm bending across there, that's my inguinal ligament. I'm going to place the ball above that. Somewhere in the middle between the outside of my hip and the midline here. So it's going to nestle in right there, just under, for those of us that have a bit of a belly, just under that place where the belly folds over right there. That's going to settle the ball into the pelvic funnel. So lie down over the ball, above your inguinal. Lie down slowly over it, let it sink into your tissue. It can be very painful. If you have sharp pain, back off from it. Let the ball sink, take some deep abdominal breaths. Once you have a nice sink, then you can begin to do the sequence that I described with the courageous ball. So you're going to contract the hip a little bit and then relax it. Do that 5 times. Bend the right knee 5 times. Lift the right leg up 5 times. Bend the knee and wave the foot back and forth 5 times. And then finally, bend your knee up to your chest 5 times. This can be very intense. If you feel pain, stop or go back to the courageous ball. If the pain persists after the session, you may have discovered a problem. Consult a doctor. If you can successfully loosen this area, you can change your posture and maybe even your organ health. As long as you have to sit for long hours at a desk, you'll need to do the stretching on a regular basis.